Hi, I'm James Spillane. I'm here in Kenai at the Denina Wellness Center, and we're going through taking a look and creating how-to videos for all the GPRA measures. Right now we're on diabetic retinopathy. We're going to take a look at this measure and what resolves it. So first let's pull up the selected measures logic and we'll see what is the numerator and denominator. And we go in here, we see that it's basically your active clinical patients that are diabetic. So they've had two diabetes diagnosis lifetime, and they are actually an active clinical patient, so they've had 2 visits in the last 3 years. So this one's a little, how we resolve this one is a couple of different ways, but let's just, patients receiving a qualified retinal evaluation during the report period. So we look at, you can do a diabetic retinal exam, we can do any other kind of eye exam. One that we use a lot in the state of Alaska and out in the rural communities is JVN. So we have somebody go in and take a picture who's trained on the JVN, and then they actually will send the picture back to a specialist to evaluate the retinopathy. And then we look at any other patients with an ophthalmology visit during the report period or optometry visit during the report period. So this is what is going to resolve it, and here's what it kind of looks like in the electronic health record. This is one of the places that you can come in. You can go into the Wellness tab, Exams, Add, and what we're going to do is make sure that we pick Diabetic Eye Exam. Select, and then we can enter the result, negative or positive. Now, a lot of times, this is one of those measures that you really want to have some case management going on. Whether you're creating a list of who's due and creating that, but also looking through and seeing if they've had this done elsewhere. So if you have connecting hospitals or larger hospitals that you work with, perhaps they've actually had this done or performed. So in Alaska, you could have this performed at A&MC. So maybe you would go up, search that, find out that the patient has already had it done, and you can actually enter an historical one. And you can say normal negative, you can say event location. So let's take a look. We'll do an historical just for fun. So we have let's search. Okay. And you can put that in there. And when was it done? It was done last month on the 5th. Okay. And there you go. If you don't have the name in that drop down, you could also do other, and other will actually, you can just hand type it in there. So we got a result, and it will go ahead, and that will satisfy that measure. Again, this is one that you're going to want to really be strong on case management and get case management involved with patient due lists. Also, before anyone comes out to your clinic, you want to print that list up, get all those diabetes patients who are due, and get them scheduled for appointments when you have those visiting specialty clinics if you're in a place like here in Alaska. All right, hope this helps. Thanks a lot, guys.